My understanding was the reason the Affordable Care Act was going to work is because healthy young people were going to go out and get insurance and pay a premium that wasn't going to get used because they were healthy young people, and that money in the system was going to keep the rates down for everyone else, and it just didn't work that way. My uncle on my mother's side is Dick Butler. He started the business, just him and one truck, and grew, got a good reputation. We are almost probably 85 or 90% residential roofing. I care about what happens to these guys when they go home. As a small business, we are small enough that we do not have to offer insurance. But we do have, at this time, one key employee, my foreman, and part of his employment package is that I reimburse him for his insurance.
I'm a foreman here at Dick Butler Roofing. My name is Bill Ballman.
When we first started reimbursing Bill for his insurance, we were under $400 for a long time. And now that it is in full swing, we're well over $700 a month. We can expense it out of the business, but we can only deduct up to $7,900, I believe. So it's better because it's now, going against my profits, but it's still a huge expense, especially compared to what it was before the Affordable Care Act.
He was willing to do anything he can possibly for me. I mean, being such a small company, he doesn't have the finances to be able to do like big companies do. And that's one thing. He came to me. I didn't even ask for it. He came straight to me and said, "Hey, I'm going to pay your insurance," which was great, and because I couldn't afford it. I mean, it was just $730 some a month.
If I wasn't paying for his insurance, I mean, he's an intelligent guy. He would know that he needs insurance.
I mean, I don't expect anything to be free. I mean, I really don't.
And he'd probably say, "Look, I'm going to have to buy my own insurance. I either need a raise or I'm going to have to start looking for another job," because that's a huge part of your monthly take. I mean, for a lot of people, that's more than a week. The Affordable Care Act made all of us that have been paying for insurance all of our life pay lots more. It's sort of like trying to balance the budget on the shoulders of rich people, and you can't do that. We all are in this together, and so it's kind of a slap in the face to call it the Affordable Care Act when you're someone like Bill that 10 years ago paid $230 a month, and now his premium is $730 a month. It's not implemented correctly. It was never written correctly. It's a political thing. It's not a healthcare thing, and that's what's sad.